we have our own pay scale separate from the usual NHS banding system. When a doctor starts their foundation year training, they start off on about £1,000 per annum. That goes up in the next year as well. So when they do their second year of training, and then when they apply for specialty training, they're usually on about £1,000. It will go up as they become until they reach consultancy level, and then at consultancy level, the average is about between pounds in America, but the average sort of figure I saw was about $350,000.
Hey, my name is Anisha Patel, and I'm obsessed with all things career development. Whether that's navigating your professional journey, gaining clarity, or building the confidence to reach your goals, I'm here to support you in crafting your roadmap to success. I've grown a podcast that has reached thousands of people across the globe. I'm growing an online business, and I'm stepping outside of my 9-to-5 to build a career of my dreams. I've walked the path of transformation myself, and now I'm here to share insights, strategies, and stories to help you carve out a career that you love, or even a podcast you've been dreaming of creating, but you've not taken the leap to start yet. If you want to connect with me in between podcast episodes, I share my personal career insights and behind-the-scenes stories with my newsletter community, which you can join using the link in the show notes. This is the Pharmacist Diaries podcast. Hey there, friends. Today is part 2 of my series with medical student and entrepreneur Leya Luhar. And it's the episode so many of you have been begging for. Literally, my DMs are constantly being flooded with the same question. Anisha, should I choose pharmacy or medicine? Well, instead of just giving you my perspective, I thought who better to help break down this subject than someone who's actually living the medical school experience right now. We're going to tackle the questions everyone's too nervous to ask about our professions and behind-the-scenes insights you might not find online in websites or in blogs. Today we're answering the actual difference between our professions and why we love them, the training pathways and how long each takes, those juicy salary details everyone's always curious about, and career progression. And who actually knows more about medicines? Is it the pharmacist or the doctor? And the real reasons we chose our paths. No, it wasn't just about the money. And whether we choose the same path again. Plus, stick around till the end for the most important piece of information, how we actually work together in practice. Let's dive right into it. Hello and welcome back.
Thank you.
I'm so excited. Episode 1 was amazing.
Yeah.
And now we get to enjoy episode 2 together. So I'm going to dive right into it. Let's talk about what a pharmacist does versus what a doctor does. From my perspective, I feel like the most important thing to get across from a pharmacy point of view is that you are a medication expert. You know everything about drugs. You know the indications, the dosages, the side effects, interactions, a lot of the pharmacology, the pharmacokinetics. This is particularly of interest to me as a pediatric pharmacist because we're covering teeny tiny babies all the way till 17-year-olds. So they're basically adults, but when it comes to pharmacokinetics, we really dive into the differences along the journey of childhood and into teenage life and adulthood. So the real kind of like expert side of medicine comes out. It does for all patients, but in pediatrics, it's very clear that we need to use that expertise. But we also spend a lot of time looking at drug development, the research side of things, clinical trials. So from an expert point of view, before the drug even comes to market, we are very evidence-based. So we tackle a lot of the scientific criteria when it comes to medicines. But majority of people will know us as the individuals on the high street, whether you're in, your local community pharmacy. A lot of individuals know that we work in hospitals. And you may start seeing pharmacists and GP practices because that's becoming a real huge thing across the UK and within primary care as well in other countries. But in the UK specifically, GP world is a new phenomenon that we're all enjoying, and a great aspect of being a pharmacist and integrating within a healthcare team. And I love that pharmacy has so much to offer when it comes to the jobs that you can do, the career progression, all of that. But when we compare pharmacy to being a doctor, what's your perspective of what you do that's different?
So I think with doctors, you have to be an expert on the broader clinical picture. So I think the key parts, I guess, that really would differentiate it is that there's more emphasis on things like diagnosing a patient and curating the whole management plan, including kind of the long term. And that also, for a lot of doctors, involves being able to actually do things like procedures. So not every doctor will do procedures, but you can do procedures, and of course you can do surgeries as well. Obviously that depends on your training and what type of doctor you are. But those are the things that a doctor can do that generally isn't part of the role of a pharmacist. Correct me if I'm wrong.
Well, coming to 2026,
Yes.
obviously things are shifting, aren't they?
Yes.
If you are an A-level student right now, it's really important for us to share that actually, if you start university and you go into pharmacy, you will qualify as a prescriber and be able to write prescriptions, diagnose patients, and really utilize more of the physical assessment skills that typical pharmacists, or the old version of a typical pharmacist, would never need to do.
Yeah.
So I'm excited about the shift.
Yeah, me too.
Yeah, it would be great. So the second thing that we want to talk about in terms of the differences is what is our training pathways like? So for pharmacy in the UK specifically, you would do your GCSEs, A-levels, and then start pharmacy as part of your university degree. The undergraduate element, which is a master's in pharmacy, is 4 years. So you do the first 3 years is kind of the bachelor side, and the fourth year you go into a dissertation, and that's where your master's element comes out. And then you would apply for your training year. So it's a full 1 year paid training year where you would put all of those skills that you learnt within the university course into practice. And majority of people would choose to work in a patient-facing environment. So either community, hospital, a GP practice, or you can go into the pharmaceutical industry. But nowadays as well, there are split placements for this training year. So you could spend 6 months in the industry, which is completely non-patient facing, and then 6 months in a community pharmacy, for example, so you get the patient-facing element. And at the end of the year, you have to take an exam, and if you pass that exam, you qualify as a pharmacist. You only get 3 chances to pass that exam to be a pharmacist, and most people do pass first time, but there is resits if you need. And from there, and when you qualify, you can obviously work in any setting as a pharmacist. So a lot of people would choose community pharmacy or your retail, kind of like high street. Or you could go into hospital. But if you go into hospital, just have awareness that you will need further education. And the expectation is usually that you do a postgraduate diploma, which is very clinically focused. The role itself is amazing, where you rotate to a different specialist area. So you might, for 3 months, be in sort of orthopedics and trauma. Then you might go to pediatrics. You might then be within the pharmacy doing medicines information, which is, again, mostly office-based, where you're answering calls, emails about queries that either healthcare professionals within the hospital or patients have about medications. So as an example, you might get a call about a patient who's on a ward, but they also take like 15 herbal tablets. And do those herbal tablets and vitamins interact with the current therapy that they're on? Instead of the doctor and the pharmacist on the ward trying to figure that out, they give the information to medicines information. We do a full literature search, figure out an answer, and give you a response. So it's a really good way to kind of like be able to gather information, summarize that information, and be able to give an answer as well. So it's a great rotation. And throughout that kind of like rotating period, you're having to do this clinical diploma where there are certain assessments, OSCEs. You have case-based discussions, things like that. So if you're going into hospital, expect that you need to do further education. And then after you finish your diploma, traditionally at the moment, you would also do your prescribing course if that's what you're interested in. But going forward, the prescribing course will be integrated, obviously, into the undergraduate degree. So it will be saving you that time. And when it comes to actually looking at specializations, As a hospital pharmacist, this foundational area, like where you're rotating to different specialist areas, gives you an understanding of what your interests are. What are you passionate about within pharmacy? Where could you see yourself actually specializing in? I'm a pediatric pharmacist now, but I've worked in all areas of pharmacy. My rotational job covered everything from like surgery, medicine, pediatrics. I worked in trauma, upper GI surgery, lower GI surgery, looking at nutrition. So I got to see loads of different things. What I did know is that I loved the patient element. So I wanted to either work on a ward or be in a clinic. And I took on also some leadership opportunities that helped me to kind of like fish out whether or not I wanted to be a manager and kind of like mentor people. But one of the beauties about pharmacy is that you can actually switch specialties kind of whenever you want. So at the moment, I have gone into pediatrics, but if, a year from now, I want to go into gastroenterology, I don't have to retrain. Part of it will be that I can gain some experience in that area of expertise by covering those wards as an example and then applying for a job. But you can actively just apply for the job and just learn on the go with experience. So that's quite exciting that we can kind of chop and change. And we don't also have to stay in the same sector. If I want, I can locum as a community pharmacist in a Boots pharmacy on a weekend alongside being a hospital pharmacist. Personally, I love teaching, so I'm an academic. I teach pharmacy students, so I'm also a lecturer alongside my hospital job. You can do work with the pharmaceutical industry. A little bit harder to get into. It's a little bit more of a unique skill set that you need. Really, really like scientific compared to the patient-facing element. But once you're in it, it's easy to transition into lots of different roles as well. You can go into the sales side of things. You can do medical affairs. You can be the scientist doing drug development. You can do research, clinical trials. I mean, literally your world is your oyster. And I've even worked abroad as a pharmacist. So I've been able to utilize my degree in Dubai and Abu Dhabi and qualified as a pharmacist there by transferring my license. I'm working both in emergency services, like working for ambulances, and part of that was the Abu Dhabi Grand Prix F1 role, which is super cool, and then a traditional hospital role as well. So yeah, there's a lot to do in terms of the upfront training, but once you get that initial training done, kind of your world is your oyster. But medicine is different.
Yeah, so definitely sounds like, from what I heard from you was just lots of flexibility, which is really cool. Really cool aspect of pharmacy that I didn't know about when I was looking into my A-level. So that I think will be definitely something that people need to consider. With medicine, if we take it back to starting and doing the actual undergraduate degree, so it's an undergraduate degree, bachelor's, and it's 5 years at most universities. Now, it's 5 or 6 years. And the reason it can be 6 years is because in the UK, for most medicine courses, you can actually take a year out after usually 3rd or 4th year to study another degree. So these are usually intercalated degrees designed to be done by medical students, but sometimes you can actually do another degree that's not only for medical students, it will be a postgraduate degree, and it can be a master's or a bachelor's. And you don't have to do it at your university. You could go to another university to do it as well. And that would make the degree 6 years. And it actually, technically, depending on the cost, so if you do a bachelor's, that is definitely covered within NHS bursary, which is why I'm doing it. I'm actually doing my intercalation right now for anyone that doesn't know. And it's just a free degree. And why wouldn't I do it? Some universities make that actually a compulsory part of their program, hence why it can be 6 years. After those years at university, you will then go on to do your foundation training. So this is 2 years as a foundation doctor, where you rotate across different specialties. So you rotate on your jobs. And the system on how this actually occurs is changing all the time. There's been some recent changes and they're being reviewed, so we're not sure if they'll continue or not. But essentially, you'll have jobs, you'll rotate across jobs. This could be in GP, it could be in different specialties. There's an element of choice in terms of you'll rank your preference. You may or may not get them, and you can potentially swap with other people as well. But you do that for 2 years. Now, of course, there's some flexibility in terms of you can do this less than full time. And if you do that, your training may take longer. But you have to do those 2 years to fully qualify. So those have to get done foundation year 1 and 2. A lot more people are choosing to take a year out for the 3rd year. So their foundation year 3, either a year out, sometimes to just kind of go on holiday or travel, sometimes to actually do some extra education in that year. And sometimes they take that year to do some teaching themselves. And then after that, you get into your training. So there's 2 main forms of training pathways, and you basically have to pick one pretty much. And one of these, one form of training pathway is the run-through programs. So this ranges from 3 years for GPs, so that's the shortest training pathway that there is in the UK for medicine, to 7 years for something like pediatrics. Now, a run-through training program means that you can only do that specialty at the end of it. So, and it'll train you specifically for that specialty. And the other programs are core and specialty training programs. So you'll do core training, for example, in something like internal medicine or surgery for a few years, and then it further specializes after that. So then you might go on to do something like endocrinology if you've done internal medicine. So with the core and specialty training program, you could do the core training and then change your mind about which particular specialty at the end, as long as it's one of those options based on the core training program you've done. But apart from that, there's not really any flexibility. So I have never had within medicine of anybody retraining at any point. So if someone starts a run-through program, they finish that run-through program. I've never heard of anybody like going back and training in something else ever. It's probably happened. I'm sure it's happened, but I've never actually seen it or spoke to anyone that's done it. So definitely less flexibility, and all the training is in the GP or the hospital environment, and you stick where you stick after your foundation training, pretty much.
I think it's hard because you have to make such a big commitment with your time once you've made your choice. So to go back and retrain is a lot of work.
And it's hard to even get in the first place, actually. So the other thing that we didn't talk about, so you mentioned, of course, there's a lot of flexibility and choice, but you're almost guaranteed that option. Is that correct? With medicine, when it comes to applying for specialty training, whether it's the run-through programs or the core and specialty training programs, you have to apply. And what's happened is the number of places for students has increased. And there's more places for students, but there's less and less places on training programs. So that's not changing, the number of places on training programs. So the competition ratios are increasing every year to the point where it's as high as, I think, 27-1 for cardiothoracic surgery. So that means that 27 people applied per cardiothoracic surgery job in the UK, all in one at one point in time. Meaning that only one person out of 27 got their chosen job to actually enter that training program. And if you don't get in, what happens? You might do another foundation year training and apply the next year. So it's getting harder and harder to actually get those jobs, and it's more competitive because while you're a foundation doctor, and even as early as medical school, you actually have to organize your portfolio around the training you want to do. So if you want to go into pediatrics, you need to be part of the pediatric society, like on the committee to get those points. You don't have to, but that's realistically to be competitive. You want to be on a committee. You want to have a publication related to it. You want to be attending those conferences early on to show your interest in that specialty. So it's so hard to even get in the first place.
That's hard. Pharmacy is a lot more flexible then. And I did my residency 3 years, so rotated every 3 months to a different specialty. So I obviously got a huge variety of information, ward areas, some things within pharmacy, some things outside within clinics and things, and just got exposure to what people do. And even by that point, you're going to most likely start to think about your specialist area, but you just apply for the job. You literally just look at what jobs are available, whether it's in the hospital that you work or you go move wherever you want to and just apply for the job and do the interview. So you don't have to be part of a specific pathway. But what the NHS has also offered for pharmacists is if you get past that sort of like initial 3 years and you still genuinely don't know exactly what you want to do, there are further rotational jobs. And instead of being 3 months, you spend like 9 months to a year in that one area immersed as a pharmacist. So say, for example, you do one year in pediatrics, then the following year you go into gastroenterology, the following year you do liver disease, the following year you do renal transplant. By the end of the kind of like however many years you want to stay in it, you never even have to leave. If you want that as your job forever, like you can keep that as your job forever. But if you get to the point where you've made the decision that, hey, actually, do you know what, pediatrics is for me, you just apply for a pediatric job. So that flexibility is totally different. And then the other spin on it is that, like, you become a parent. You then realize that actually hospital life is not for you. And you then decide, actually, I want to go part-time. I'm just going to locum in a community pharmacy. Boom, you just apply for the job. Obviously, you have to sell the skills that you've got, but most of the time, you will have the skill set to be able to achieve that. But you can just then chop into community pharmacy for 6 months to a year. Some of the younger generation will do locuming because you get paid a little bit more. You have the flexibility to work whatever hours, times that you want, save money, go traveling, come back, locum a bit more, save money, go traveling. And then they go into a hospital job afterwards, which is more of a permanent position. But at no point are you applying for like a specific training pathway and then you're trapped in the pathway.
I'm envious.
Yeah. It's very different. And I think for A-level students or people thinking about pharmacy versus medicine, it's really important to know what kind of commitment you're putting yourself into. And if you're not sure exactly what you want to do, at least pharmacy gives you the option to sort of swap and change. But if you're very like clear, I want to become a pediatrician, you know there's an absolutely incredible pathway for you to just like go into and dive and go all in, which is just amazing if you have that figured out. The third thing I wanted to go into, which everyone loves hearing about, is like, what are the salaries like? Like, this is really important. Before we dive into the next part of this episode, I want to share something I've been absolutely loving lately. I bought these blue light blocking glasses from OsCE and I'm absolutely obsessed. As a pharmacy student or pharmacist, we are constantly staring at screens all day long. And for me personally, I'm also using them several evenings of the week when I work on my podcast. So I was feeling really guilty about this and having so much screen time in the evening. And I knew it was definitely impacting my sleep quality. So I treated myself to these glasses. I wear them every night when I get home from work and I'm absolutely loving it. The frames are really stylish, and more importantly, they obviously filter out the really harsh blue light that can negatively impact your sleep cycle and cause eye fatigue. I've noticed a really big difference in my sleep quality, and I wanted to share it with you because it might be a tip for something that you could treat yourself to as well. I found a 20% off family and friends discount code on their website, which you can access from the link in the show notes. Now let's get back to the episode. So from a pharmacy point of view, when you do your training year, which is the 1 year before your exam, it is paid, which is great. So even as a trainee, you get a full-time salary, which is awesome. It's not that much. It's around, I think in communities, probably around like £20,000 or £22,000 for the year. And hospital probably is around 24 or 25, a little bit more. But when you qualify as a pharmacist, depending on where you work, obviously your salary will be slightly different. Community pharmacy initially starts off with a slightly better salary, around probably £40,000, maybe a little bit more if you're lucky. But hospital pharmacy is NHS usually, so we have a special banding system. So as a trainee pharmacist, you come in on a band 5. When you qualify, you're a band 6. You finish your sort of core training and that clinical diploma. If you become a specialist, you usually enter into a band 7 post. And then as you become a sort of manager and you're kind of leading a team, you'll go into an 8A post and then you can do 8B. So the career progression from that point of view and the salary increases as you become more specialist. And with NHS banding, each year you get a small increment within the banding. So the first 5 years, you get a small sort of pay rise. And then once you've done 5 years in that job, you usually get a little bit of an extra bump. And that works across all healthcare jobs. The banding system is completely equivalent in all healthcare jobs. And if you go into industry, I believe you do get paid probably more than the NHS has to offer and what community pharmacy has to offer. And with community, career progression is more management. You become a store manager. You might then start becoming a regional manager where you're looking after multiple shops in one area. So your career progression and your salary increase is usually related to a management position or a leadership post, which is really different to hospital pharmacy because you're becoming more of a specialist. You're identifying your niche area and kind of diving into that. It's really different if you live in the US. I can't believe how big the salary differences are. You qualify as a pharmacist and you earn well over like $100,000 a year, which is so different to the UK. You do come out of pharmacy school with a lot more debt. So on average, pharmacy students in the US are coming out with at least $150,000 to $200,000 worth of school debt, which is massive. And there's an incredible pharmacist in America. His name's Tim Ulbrich, who has a podcast called Your Financial Pharmacist. And he's really helping to kind of navigate finances for pharmacy students as well as early careers pharmacists and understanding what to do with your money. Because when you study pharmacy and it's such a well-respected profession and you know you're going to have this 6-figure salary, you just don't think or worry about money because you're like, I'm earning a 6-figure salary, like, how hard can it be? But when you have so much debt and you don't know how to pay that off or understand kind of the realities of what that means for you, he's breaking that down. He's going into universities now and teaching within curriculums. He's doing loads of amazing webinars online and he's got amazing services that help you as a pharmacist or a student to figure out how to manage your money. I love it. It's great. It's a great concept. But medicine's different. I mean, even here in the UK, definitely doctors get paid more than pharmacists do. What is it like for you guys?
So we have our own pay scale separate from the usual NHS banding system. So using just some sort of average figures, when a doctor starts their foundation year training, they start off on about £35,000 per annum. And that goes up in the next year as well. So when they do their second year of training. And then when they apply for specialty training, they're usually on about £50,000. And then they do this, it will go up as they become, until they reach consultancy level. And then at consultancy level, depending on how long they've been a consultant, the average is about between £105,000 to £140,000. Now that can obviously differ per specialty, but those are just kind of the average figures to give people an idea. And in America, the contrast again, very large. So it can vary a lot more in America as well, based on specialty and like what type of doctor you are. But the average sort of figure I saw was about $350,000 per annum. So again, massive difference. I'm not too sure what the debt is, but I imagine also very huge. But yeah, so that's the pay amount. It does continually go up. So similar to pharmacy, yeah.
Awesome. And then the most important thing that I really wanted to discuss today and to help people to kind of navigate which aspect of their career they want to choose is, what's the satisfaction like? What's the lifestyle like? And I want to make it really clear that when you are maybe 17, 16 years old trying to figure out your career journey, just remember to fit your job into your life and not your life into your job. It's so hard. It's hard to make these decisions, but I think a lot of 17, 18-year-olds who are making these decisions kind of just look at the job itself and think, do I want to do that? Can I see myself doing that? Am I going to be good at it? And do I have the skill set? Or what are the strengths that I have within school. So if you're good at sciences, a lot of people end up picking, pharmacy or medicine. But I think it's important for the younger generation and people who are listening or watching this episode to think about, what do you want your life to look like? And then choose a job that fits into that life. Do you really want to be doing on-calls? Do you want to do night shifts? Do you want to do weekends? Do you want to have a family? And what type of lifestyle do you want to have if you've got children? Do you want to be able to take a break whilst you have young children at home and work part-time or not work at all? Do you want to travel the world? And is the job going to allow you to be able to do that? Do you want to be kind of like tied down to the very hard hours of a hospital job versus the more structured environment of a community pharmacy or a GP practice, which has really set hours and not much extra alongside of that? And then also there's the element of, do you really want to be patient facing or not? Because if you like the idea of having a flexible life where you don't have to wake up so early and do the crazy commutes or, run around driving long, hours just to get to work, versus being in the comfort of your home all day, every day, and enjoy that, which I love because I have the flexibility to then exercise more often, like be able to cook nutritious meals for my families, be able to do the school pickups and drop-offs. So I think it's really important just to share that when it comes to lifestyle and choosing the job, just envision what your future should look like for you and what you're excited about your future to look like, and then make sure that the job can fit into that. So from a pharmacy point of view, again, like we are so lucky that there's a lot of flexibility. So if you go into a hospital job, more than likely you will start your journey doing on-calls. Now, depending on what hospital you choose, there are two sort of on-call services. There is a residency program, which means that your on-calls are usually done on-site and you live on-site. My residency, I used to start my night shifts at 4 p.m. and I would be in the pharmacy working like an absolute machine. And in that sort of 4 p.m. till midnight, I would answer about 150 to 200 bleeps from other healthcare professionals requesting information, processing prescriptions, discharging a patient, looking at drug interactions. There might be someone in the theatre and they need something really urgently and you've got to think fast on your feet. But in terms of the skill set for me, it was really valuable to go through that process because I built my confidence. I became a lot more assertive. I could answer questions quickly. My clinical knowledge expanded at an exponential rate. And I definitely think it was the most valuable thing that I did for my career journey, but it's not for everyone. But in opposition to that, there are on-call services where you finish sort of your 9 to 5 and you just take the bleep home, and you may only get bleeped once or twice in that evening. You might not even get called overnight. And so it depends where you work, what services that they offer. But in the early start of your career journey, 100% hospital jobs expect on-calls. So that's a given. And weekends. Hospital jobs throughout your kind of journey, whether you're newly qualified or you're an experienced pharmacist with 20, 25 years of experience, you will do weekends. Some are going to be, 1 in 8 weekends. So, every 2 months you do a weekend shift and it's just shared within the team. And you also will have to then do bank holidays. Christmas Day will come up, so you will have to work on Christmas Day. Maybe alternate years or every 2 to 3 years, you're going to have to do maybe Christmas Day, Boxing Day, or New Year's Day. So just think about whether or not you really want that in your life or whether you want true kind of like downtime. It's hard to get annual leave. You've got to ask for it quite far in advance. And yes, you do get your annual leave and yes, you do get breaks, but I think it's a little bit more challenging to kind of get time off because of the team dynamics. And if you do work weekends, you tend to then have a couple of days off in the week, which is quite nice sometimes to be able to do just life admin and be at home and chill. If you work in community pharmacy or in a GP practice, hours are a lot more structured. You might work 9 to 5 or 9 to 6. Community pharmacies, I think sometimes you do have to do Saturday shifts because pharmacies are open on the weekend. GP practices, not so much because they're not normally open on the weekends. So you have a lot more structure. You don't have any sort of on-calls with those type of jobs. And then obviously there are lots of remote jobs now, whether you're working in IT, finance, some leadership positions can be completely remote. There are now so many online clinics for pharmacists where you can work completely remote. And you can choose your hours, work part-time, have flexibility to just do certain hours of the day. So that's awesome. And if you work in industry, traditionally, it is standard office hours. So just think about that from a kind of work-life balance point of view. On-calls are hard though. You kind of have to do it for a certain number of years and then you don't. But they are taxing when it comes to work-life balance. Everything is just work. For me, even with residency, my whole life revolved around the job in those first few years. I was really strategic though with my time off. I actually did more night shifts because if you did like a set of 4 nights in a row, you would tend to get 3 days off as like a long weekend, which I loved. And then I would add on an extra day of annual leave. So I'd get 4 days of rest. And with my time, I used to fly to Dubai to go and visit Sanjay because we were dating. So I used to do a night shift, finish at 8 a.m. and then go straight to the airport from work, fly to Dubai, and then organize a night flight on the way back, get to Heathrow, get the bus from Heathrow to Oxford and take a late shift. Yeah. So starting at 11 and go straight to work from the flight. And I did that for 3 years during my residency because I was in love and it was spontaneous and I was young and I could do what I want. But, it was a big element of joy for me. So I'd work really, really hard for 8 weeks, do that multiple night shifts and kind of like gather up the annual leave and then travel with that. And yeah, I loved it. And in the evenings, once a week, I used to locum in a community pharmacy for £25 an hour. So I used to earn £100 in that 4-hour shift.
Oh, nice.
And then just save that money for flights. Yeah. That was every week. So I earned an extra £400 a month just for flights. So that really helped me in terms of my work-life balance and knowing you've got this 8-week time slot of working really, really hard, but then you get to enjoy a luxury 4-day weekend that you really have fun with.
Work hard, play hard.
Yeah, totally.
Yeah.
So I guess from the point of view of doctors, work-life balance is a little bit different. Maybe you can dive into that.
Yeah, I think overall the picture is generally work-life balance is probably known to be a little bit more difficult as a doctor, I would say, broadly speaking. It does vary between specialties. So for example, and it depends, I think it varies based on specialty, but also where you are in your training and your experience. So for example, for pretty much all foundation doctors, you are rotating on specialties and you're expected to do a lot of time. There's a lot of time, especially not just to do the job, but also the portfolio building that you need to do to beat those competition ratios that we talked about earlier. So it is very, very time consuming and there are a lot of on-calls that you have to do and there are mandatory night shifts as well that you have to do and everything, all of those things are unavoidable. You have to do what is given to you. And there's a big lack of control in that as well. That's a reason why a lot of people are doing, there's foundation training programs that you could do that have an element to them that is either academic or managerial. So you can do a management program, you can do an education program, and you can do a research program as well. And what that does is it replaces one of your jobs with the either doing research, management, or education, so teaching. And that gives people a bit more time and flexibility in the years that they're doing their foundation training. And then in terms of the actual specialty, so even when you're doing your foundation training, it's kind of known if you get something like psychiatry, you get a little bit more of a break and it's a little bit more relaxed. And GP as well is known that it's a little bit more, there's not really emergencies as such as there might be if you get emergency medicine. And then in terms of when you actually go into that specialty as well, it's different. So a lot of the time, traditionally, as you get higher and higher in the ranks and as you become a consultant, it's supposed to be more relaxed. So it's supposed to be kind of less on calls. The people that are more junior to you will handle the majority of the workload. And it's supposed to be, you know, oh, I'm just working. A lot of people will say that they're just working really hard until they get to consultant level. That's the picture of it. And then you're a consultant and you can sit back and rest and have your family and go on holidays every now and again. However, in certain specialties like pediatrics, it's sort of different from what I've heard, in that actually the consultants do take a lot of responsibility over the juniors. So that picture is a little bit different. But overall, it is quite rigid, and there isn't, it's dependent again on specialty, even in terms of whether you can go less than full time or not. Pediatrics specifically, because there's a lot of females traditionally that go into pediatrics, there is a lot of flexibility in many programs now where you can take, in terms of taking time off and hours worked, and the actual training. So basically, broadly speaking, there is less flexibility baked into being a doctor overall, with work-life balance, on-calls, etc. But it does vary significantly across specialties.
Awesome. The fifth thing I wanted to go into was, what are our similarities? Because there are quite a few.
Yeah.
The main thing is that we're patient-facing. We are traditionally very patient-oriented as healthcare professionals, and our aim is to support the patient on their journey in whatever context that may be. But it's to better the journey for the patient in terms of their health, medicines, whether it's surgeries, whatever it is to do with the condition that they have. We are there to support them to make their life, their quality of life, and the way that they manage a disease way better than where they're at in that moment. And we're solving a lot of problems. And I love that.
Yeah.
And I absolutely love the patient-facing element of it. I've got this thing in my head now because I've been qualified for 14 years, and most of that journey has been patient-facing, with the exception of working in emergency services when I lived in Abu Dhabi. I finished my residency and moved out to the UAE to be with Sanjay because he was obviously working there. And the first job that I got was in emergency medicine, but it was actually a leadership job. It was supporting ambulances with medication supply. So I learned a lot about procurement. I learned a lot about international supplies, how to import medications. I was running a pharmacy on my own because I was the only pharmacist in the organization. So I had this amazing opportunity to learn about leadership. And this is where my passion for education came from, because I started teaching paramedics. Because when the company started hiring at an exponential rate, loads of additional services were being offered. Ambulances went from sort of like 20 to 30 in the company to over 150. You obviously have to have staff to be able to manage them. They were hiring paramedics from all over the world. You had Americans, Irish, English, like New Zealand, Australia, a lot of technicians who work on ambulances, the EMTs, they're from the Philippines. And they've all come from backgrounds where they use different medications. They have different indications, different drug dosages that they would allowed to be used legally. And when I first started that job, I was working with a company who, when it came to sort of paramedics, they didn't have access to drugs on ambulances, surprisingly. So part of the job was to change law for the country, which we did. Wow. So we moved from not having a pharmacy, having no medicines on ambulances, to having a formulary of drugs, importing drugs from all over the world, teaching paramedics what they can and can't do in terms of the legal side of things and prescription writing. And part of Formula One was doing the same, getting doctors licensed, educating them on how they use medications when it came to the F1 event, and if they were using it on drivers, if there were crashes or anything like that. So I learnt this whole other side of pharmacy, which I never ever thought that I would be exposed to.
Yeah.
But I missed the patient-facing element and moved back to it. So most of my journey has been very much patient-facing, and I'm finding it really hard to let go of it. Mm-hmm. Because now that I'm entering into entrepreneurship, which is really exciting, and building a business, building a brand, I want to spend more time on this, but I'm also struggling to let go of the identity of being a traditional patient-facing pharmacist. It's quite tough. But in terms of our similarities, patient-facing life is what we are used to.
Yeah.
But there are other things. I mean, from your perspective, what other similarities do you think we have?
I think I agree. The roles are very, very close. The teams that we work in as well are quite close. So pharmacists and doctors do generally work very closely together. The things that we're working on are close. It's just more the differentiation is in our actual responsibilities and our focus on the patient. So as you were saying earlier, pharmacists being absolute experts on medications, for example, whereas doctors might be focusing more on the whole management plan and procedures and things like that. But broadly speaking, really and truly, in the bigger picture, we're very, very, very similar in terms of our goal is all about patient care. And we are usually, like you said, patient facing. And the roles are already getting more and more similar. I mean, in general, when we are talking to patients, we are trained to think holistically, whether you're a pharmacist or a doctor. So we will both be giving patients lifestyle advice. We'll be giving them preventative advice for managing their health, and managing things like chronic conditions. We can both do as well, and that makes up most of the NHS costs as well. Is long-term conditions, and we're both able to do that and do things like reviews with patients as well. And counselling patients as well on lifestyle changes, or even medication counselling, where pharmacists are generally in a better position to do that. But sometimes doctors will do that too. And it's only getting more and more similar, isn't it?
Yeah, definitely. The other things that I was thinking about was that we are expected to do a lot of like CPD or continuing professional development. If you are to keep your pharmacist license active, there are certain kind of things that you have to do from an educational point of view, where you have to prove that you're keeping up with your professional development and keeping up with the times, because with both pharmacy and medicine, things are evolving all the time. New evidence is coming out, new drugs are available, new strategies on how you approach a patient, like building on your communication skills, looking at how you can be a better leader. As you go through career progression, you're managing other staff, you're mentoring students that come through your rotations, all of that. So you need to make sure that you are keeping up with that. And then the other thing also is that when you're looking at it from the point of view of the responsibility, it's a job where both professions take on a lot of responsibility when it comes to patient care. Every time you sign something on a drug chart or an electronic signature, like you're taking responsibility for the decisions that you make, the problems that you solve, the changes to the medication routine, or for you, how do you diagnose a patient? Like you take a lot of responsibility ordering the right tests. Do I do an X-ray? Do I do a CT scan? What blood tests do I do? How do I analyze these tests and summarize all of that and then make a decision? Like making a decision is huge. And it's the same with pharmacy. We're analyzing all of the information and making a decision on a change. Maybe someone's kidney function is not great and you're having to adjust a dose in order to make a change for the patient, but you're having to make a decision. And you're then telling the doctor, this is my area of expertise. This is what you need to do so that we don't have toxicity, and we look at medication safety. And we make adjustments. So we work together. It's very collaborative. But in terms of the skill set, we're using very similar skills.
Yeah.
So what are the, I guess this is the last thing I wanted to cover, was that what are the emerging roles for doctors? What are the new and exciting things that are coming out for people who choose medicine?
There's a lot. It's becoming more and more common to branch outside of medicine after getting your medicine degree in terms of the traditional medical roles, and, just doing your FY1, FY2, and then entering and training programs, which we mentioned earlier. So I think, for example, a huge one is going into things like technology. There's more and more kind of, technological health devices, and for example, wearables. There's more and more wearables, for example. I mean, one thing I definitely recommend for students, regardless if you're interested in healthcare, is going to like a health tech conference. Very exciting. But all these companies need medical consultants. They need medical specialists. They need people that actually understand healthcare and understand patients. And a lot more people are going into that, or even doing that part-time if possible. So that's something that's really exciting, I think, for a lot of people that are graduating from medicine and maybe don't want to stick to the traditional role, or maybe just want to do something else on the side. So doing that. But then also there's other things that people can go into. So for example, they can actually move into the finance sector, and there's programs that are actually aimed at people in medicine to support them to do that and identify if they have actually got potential. There's a organization called Beyond Medicine. I think they're rebranding now, but they were a group that were holding conferences and had a newsletter that were focused on medical students, to show them the opportunities that were actually out there beyond medicine. So yeah, that's some stuff.
Awesome. I mean, Pharmacist Diaries podcast is a great place to start. Lucky for all the A-level students who are figuring out which path to go down. Yeah. There's, over 170 episodes for you to navigate what options are available. I think in terms of emerging roles, I just think we are so fortunate that the initial degree that you get is literally the launch pad to so many other things. And if you don't want a patient-facing job, that's totally manageable. Yes, the initial degree will make sure that you're ready to be patient-facing, but once you qualify, you can go into anything sort of even IT related. Everything's turning electronic, from prescribing systems, how we order medications, procurement, supply chain, and everything's electronic. So we need pharmacists who are experts at building some of those programs. And I'm seeing a lot more pharmacists going into that, not only because they want to utilize a different skill set, but it also allows you the flexibility of not having to do weekends, night shifts. You can work from home. You could, live in another country and do the work if you really wanted to. So that flex is really good. I've seen so many new pharmacist entrepreneurs, and even across the globe, you've got these incredible, even in the US, we're really getting into pharmacogenomics and understanding your genome and choosing specific medications according to what you actually, can test individually. And pharmacists are running these awesome remote clinics and helping you to navigate exactly what medications are going to work for you as an individual. Like me, you can go into academia. So it's quite exciting that there are split roles. So my old permanent job before I became a locum most recently was 3 days as a pediatric pharmacist and 2 days teaching. And the 2 days teaching was just wonderful. Nothing is ever an emergency. You're enjoying speaking to students. You're creating content. You're actively teaching. You're managing assessments. You're doing OSCEs. You're marking. And a lot of your time is managed by you. You're not really set by a schedule, which is really, really nice to have that flexibility. And you can work from home unless you need to come in and teach at the university. So that flexibility is always really, really valuable. And love that. And so 2 days of the week, I had that kind of balance where I was able to do a school drop-off or a pick-up or take Lily to a club. The university were amazing, where I might work 9 to 3, do the whole school and child life, and then pick up the extra 2 hours in the evening, because you can. So that kind of flexibility when it comes to kind of emerging roles and new things that are happening is obviously a winner if that's what you're looking for. But there's also the clinical entrepreneur program through the NHS. So not just for pharmacists, but doctors apply to that as well. So say, for example, you've got all these maybe skills in coding and app development, things that probably you're learning through school. You can go through the clinical entrepreneur program and develop anything. But a lot of people you see go through it and they're developing something online, especially apps to help with patient care journeys. I've seen physiotherapists create these online training programs like post-op in terms of rehab, and they're creating videos that they can show to patients in terms of what rehab to do. You get the virtual consultations. You have a checklist of things that you need to do, the number of reps that you need to do, the stretches that you do, and the physiotherapist can see all of that in the back end and make progress with, recovery. And so there are so many cool things that are happening that I think are just molding what all of our careers are looking like. But the most exciting thing is it's always changing. And I think that's one thing, whether you go into any healthcare kind of pathway, just be excited that things are constantly shifting. So if you're not quite happy where you're at right now, you can alternate your journey as well.
Absolutely.
Oh, well, I think we covered loads of stuff. So that was an incredible kind of episode 2.
Definitely.
And thanks, obviously, for your time and sharing your perspective, which I wouldn't have been able to give all of those thoughts if I was doing this on my own. And watch this space for episode 3.
Could I mention the website for the extra resources? Oh, yes. Okay, so for anyone who's doing A-levels and is interested in pharmacy, if you go to OSCEtoolbox.com, we have an article section, which will be linked in the show notes. And we have articles all about pharmacy interview guides, pharmacy personal statement guides. And also we've got information on interviews at every pharmacy school in the UK, which I rang them up and emailed all of them individually and harassed them actually to get that information. So please check it out. But also excitingly, and I've not really announced this anywhere, but we are actually going to be going to sixth forms and colleges to be giving some information on pharmacy as well. So if you're interested in that, feel free to get into contact with us if you want to help us come to your sixth form or college.
Awesome.
Cool.
Love it. Here's a mistake most people make when choosing a supplement: not considering the source of the ingredients. Many supplements use synthetic vitamins within their ingredients. This means they have been made in bulk in factories to mimic natural vitamins. They are chemically identical to vitamins found in nature and often more cost-effective and widely available. However, and this is the most important point to remember, natural supplements and those that come from plants, fruits, or other natural sources have additional benefits and often contain extra nutrients, fibers, and plant compounds that support your overall health, and they are generally easier for the body to absorb. Check out thenakedpharmacy.com, where you can find naturally sourced supplements for your health and well-being. Use code PD20 at checkout for 20% off your purchase.